I just wanted to read everything I could read about mental health conditions, depression, bipolar disorder, ADHD, and Black women, and found that there was not a lot of research. There was not a lot of research articles. There was not a lot of information that, talking about the challenges. So that made me want to think about, how can I change that? How can I be the change that I was seeking? And so going into the mental health profession, I really stuck with social work because it gave you the breadth to do different things, but also because social workers are trained to look at all aspects of a person's life, not just what you're presenting as far as your mental health conditions, but looking at your community that you belong to, looking at your family history, looking at the work that you do or the desires that you want. And what I felt like was working with a social worker. Social workers were definitely more focused on listening and trying to create solutions that the client wants. And that was the thing that really sold me on, okay, I'm gonna go down the track of becoming a social worker to become a mental health professional. I definitely want to help people. That's always been something that was, I guess, ingrained in my childhood. My parents, helping people, both my parents are in the medical profession. My mom's a nurse, my dad's a physician. And so helping people was something that I grew up seeing. But when it came to mental health challenges, the community that I grew up in the Caribbean community, it was taboo to talk about mental health challenges. And so I really wanted to become more vocal about the reality that our mental health impacts us just as much as our physical health. So that's why I decided to go that route of being a helping professional, looking at mental health care and definitely looking at the challenges that exist in our community, the Black community, the Caribbean community, when it comes to the stigma when it comes to seeking mental health treatment. One thing I could say as far as my journey as a student is that I've been in this program working full-time as a civil servant for the federal government and going to school part-time then full-time. And it's been difficult, but I would say that everything that I've learned in class and definitely in engaging with professors and students in courses definitely motivated me to keep at it. There were many times I was like, this is crazy, I'm in my 40s. This is gonna be a change of career for me. But definitely all the engagement that I had in my classroom with the professors and other students kept encouraging me to keep at this, even though it's been a very, very difficult journey. And then just support from my family to continue making the difference that we want to see. Professors have all encouraged me to keep at it, and some of them are asking me to do PhD work because of my interest in research and wanting to really diversify the voices of research in mental health care. So I would say that the biggest thing was just when you go into the profession, the community of support that you get from other social workers, from the professors, from students, that definitely helped encourage me to continue through in the program.